So I am Kate Trams, and I am with the TOR Technical Assistance Center. We're part of the National American Indian and Alaska Native ATTC. You'd think that I'd have it down how to say that by now, but it's such a mouthful, so still need to practice, I guess. We are supported by SAMHSA, and we usually give a disclaimer about the content of this event, not necessarily reflecting the opinions of SAMHSA, but this is a webinar directly from SAMHSA, so the information is coming straight from the source, and so nothing to worry about here today. I want to let you know we will send you a follow-up email, probably either later today or tomorrow. It'll include links to the presentation slides and a recording and information about how to request, or I'm sorry, we actually can't offer CEUs for today's session, so I apologize if that's on there because we don't have CEUs for this session today. But we do have a link to our GPRA survey. I'm also going to put that in the chat in just a minute. In case people have to hop off early, we'd love to have you still let us know what you thought of today's session. And we do want to take a moment, even though we are gathered virtually today, we want to acknowledge and take this time to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken and inhabited. Past and present, we want to honor the land itself and the people who have stewarded it throughout the generations. This calls us to commit to forever learn how to be better stewards of these lands through action, advocacy, support, and education. We acknowledge the painful history of genocide and forced occupation of Native American territories, and we respect the many diverse indigenous people connected to this land on which we gather from time immemorial. While injustices are still being committed against indigenous people on Turtle Island, today we say thank you to those who stand with indigenous peoples and acknowledge that land reparations must be made to allow healing for our indigenous peoples and to Mother Earth herself. This land acknowledgement was created by 3 members of our team, Ella and Keely Driscoll and Sean Bear. I want to thank them so much for creating that for us. Again, I just wanted to mention our short survey that we will put up in the chat, and I'll would encourage all of you to just let us know what you thought of today's session, if you thought it was helpful.
Kate, I think we lost your audio. Let's see.
Yes, I cannot hear you, Kate.
So it's not just me, okay. We'll give Kate a sec to regain her voice here. But in the meantime, maybe, Amy, we can introduce ourselves. So hello, everyone. My name is William Longinetti. I think I've met a few of you and we work together, and I'm a project officer on the Tribal Opioid Response Grant, and I'll be co-presenting with Amy today. So it's good to see you all.
Good afternoon, everyone. My name is Amy Romero. I know many of you. I am very glad that you took the time this afternoon to attend this presentation. I hope that you find it helpful. And I'll be presenting with Will, but at the same time, we really want to hear the type of activities that you're implementing with your TOR funding. All of these, a lot of examples that I will provide today actually came from your annual reports or from conversations that I had and William had with each of your programs. So these are actual activities that we will share that programs are doing in different tribes. And please feel free to share with us additional things. If you're doing anything that you think will be something that other programs could learn from and share, please share on the chat, and I will open up From time to time, I will have a section for questions, if you have any questions, as well as for sharing any strategies regarding prevention, treatment, and recovery. Okay, so at this time, I'll see if we can hear Kate. You want to try to speak, Kate?
Can you all hear me?
Yes.
Yes. Okay. All right. I don't know what happened. That's so weird. I joined by phone to make sure that it would connect. So I apologize. But I was just about to introduce Ray Daw because I asked him to open us up with a blessing. So if we could take a moment and have Ray Daw have us start off in a good way, I would really appreciate that. Thank you.
Okay. Thank you, Kate, and good morning, good afternoon to everyone. I noticed a couple of Navajo people online, so I need to do a formal introduction. My mother's clan are Kea'ani. My father's clan are Azatlan. And my maternal grandfathers are Tsitnachini, Blackstreet people. And my paternal grandfathers are Twitachini, Bitterwater people. Those are my clans. I'm originally from Hawk, Arizona, which is in the south part of Navajo land, Navajo country. But I've been introduced by my name, and that's who I am. I'm coming from the Gallup, New Mexico area today. It's where I reside with my family. But appreciate the opportunity to do blessing, and offer a blessing, and get us going today. Come on with that. Kudojuna Stansh Mashatra. Yadil Yeltin Nedanotini Kui. Tatlas Twist Charles Yeli Hayolka, Australia, J1. Natal Gish Kinatal Suit. Tradinish Kil Donate Kudo. The Nedanotini Quailtan, Lord of the Yolkati, the teacher. Nantien Lini Quenfa, Baho Ato, but yet over the Iliado, the Santish Nakudiani, so quite he cranky. I don't think he gave it and Lini of Dana London, to reach Jade. Kerchina, there was Dana London, Yatio could he not at all asked Santish Nadine. By Kodoyatio, Gian, that Lini could have put it on Lini. Jenna so bad not on it, not school. Yeah, so there's a lot so could Ishlar the end Dico. In that and Lini kid at Lini quite he craig. I could yatio. But I yard of left or yatio, could not school none that be not on it, so much snakui. The internet could. By could not sleep, was not sleep, was not sleep, was not sleep. I offered a blessing for us to have good benefit from this learning opportunity and the teachings that are going to be coming to us as we incorporate words given to us into our lives, into our thinking, and into how we are as we work for our people and our families, and for us to live good lives, to take the food and water we have into our bodies, and to sustain us well also. So that's the blessing I offered. Thank you very much. Yeah.
Thank you so much, Ray. Really appreciate you helping us to center our thoughts and minds as we go into this topic today. So yeah, with that, I would like to pass things over to William and Amy. Thank you all so much.
Thank you, Kay, and thank you, Ray, for the blessing today. Okay, so I will share my desktop and share our PowerPoint presentation. Okay. Great, I think you should be able to see my PowerPoint presentation. Yeah, okay, great. Well, again, good afternoon, everyone. Welcome to our webinar today. During this webinar, we will provide some guidance on how to spend the TOR funds, but we want to make sure that all the costs for TOR are always allowable, reasonable, and allocable. So that is our guidance. All costs must be allowable, allocable, and reasonable, and must be listed on the funding opportunity announcement, and we will cover that today. And some of the information that we will share during this presentation may not be allowable for grantees that are currently in a no-cost extension. So if you are in a no-cost extension, that was approved to ensure that you complete your originally approved project goals. So there are some differences for grantees that are in no-cost extensions, and you can make budget revisions only under 25% of your funding versus other grantees that are in year 1 and year 2, and you can make more significant changes on the activities, objectives, and on practically, if you find something interesting today, you could let us know, and we could work with you to ensure that you implement that. TOR required activities. So SAMHSA outlines the TOR program's required activities starting on page 7 of the funding opportunity announcement. And we will cover during this presentation all the required and allowable activities, and we'll give you examples on how these programs are using the funds. Please keep in mind that you can select activities. You do not need to implement every single activity that is listed on the FOA. Also, the activities are not limited to the ones that we're discussing today. If you have something else in mind, just let us know. Things are not limited to our examples. So we will start with the strategic plan. You may use funds to develop a comprehensive strategic plan to address gaps in prevention, treatment, and recovery. You can work with a consultant to develop this plan. You can build a coalition or conduct focus groups, or you can do a community readiness assessment. So these are just some things how programs are using the funds for the strategic plan objective. Here I have an example that was developed by the ATTC. And this is just the template that is on the ATTC website, and you're free to use this. And you can list all of the objectives, the activities that you plan under each objective, who is the responsible person that will work towards meeting this activity, that will work on this activity, the target date, and the completion date. So this is a very helpful document that could really help you stay on track on your goals and objectives. But if you don't have a strategic plan and that is not one of your objectives, that is fine. Again, this is how you could select the required activities. Workforce development. Many grantees are using TOR funds to provide training for behavioral health staff, clinicians, law enforcement, and other team members. You can hold buprenorphine waiver trainings. You can attend or host trainings on evidence-based practices such as CBT, motivational interviewing, trauma-informed care, any cultural practices, and telehealth. You can hold peer and recovery specialist trainings and certification for your peer mentors. Many of you are working to get your peer mentor certified to be able to bill for services. So I know in some states that is a priority to be able to get the certificates, to be able to bill. So you can pay for that process with TOR funds. You can cover for licensure and certification for your clinical staff. You could also attend national, state, and local conferences and any training events. As well as you can have other trainings that are related for other aspects of the grant. For example, accounting. You can have your accounting and your finance staff participate in training that is relevant to their work. Prevention. So in regards to prevention, you can use TOR funds to develop any type of prevention strategies. Of course, you want to make sure that they're evidence-based. You can hold a school-based or community-based prevention events or programs like the Bodvin Life Skills for substance use and violence prevention. You can do elder education, outreach, and engagement. You can purchase and distribute prevention education materials at events, things like brochures, posters. You can develop a prevention campaign or a media campaign. Many programs are using social media like Facebook, Instagram, Twitter. You could also purchase billboards. So if you have a highway really near you, I know a lot of programs are purchasing those large billboards and putting them on the highways with educational messaging or information about their programs. You can also implement harm reduction programs. So the only limitation that we have with that is that SAMHSA does not allow you to purchase syringes for the harm reduction program, but you're able to pay for all the other costs like staff, a counselor, any other part of the program. You could implement the entire harm reduction program with TOR funds. The only limitation is no purchasing syringes. You can also purchase and distribute fentanyl test strips, doTERRA drug disposal pouches. Many of you are doing that. Medication lock boxes, as well as planning a GONA or any type of event and community event. So this time I just want to pause for a little bit and ask, what are you doing in regards to prevention? If you could think of other strategies, other activities, please feel free to share with me. Any other ideas, anything that you would like to implement regarding workforce development and prevention? You can put in the chat as well.
And Amy, this is Will. I know we're going to cover this a little later on, but you know, maybe some people aren't experts at doing social media or, you know, drawing up like a media campaign. I know some of that stuff can be complicated. So are they able to, you know, hire or contract with an outside company who, you know, has that expertise?
Yes. Yes. So you could also do contracts for multimedia campaigns or any type. If you need to develop a video, you could have a contract with a company that could help you develop a video that you can post on your social media or that you can post on, you know, I know programs are showing the videos at doctor offices, at different clinics, at their local TV stations. Yes, okay. So
Amy, I just got a request to do expert training at a couple of I think it's a full range of staff at the middle school and high school level. So that's another example of a prevention activity that that was requested.
Yes. Mm-hmm.
And we're getting a couple responses in the chat here. So Mitch Markovich asks, what are some examples of a harm reduction program? So I know Amy listed a few. I guess, you know, maybe depending on who you ask, they might say different things are harm reduction. One of the biggest is what Amy mentioned, syringe exchange programs, you know, syringe services programs. But, and again, you know, we support those, but unfortunately, you're not able to use federal funding to actually buy the syringes, but you can use the funding to support, you know, other expenses related to a syringe services program. Fentanyl test strips are another harm reduction intervention that SAMHSA recently announced that, you know, we were supporting and you can fund. Naloxone distribution is a type of harm reduction intervention. So, and you know, there's definitely others that we haven't mentioned.
Okay.
Let's see, Amy, we have like 7 or 8 responses. I don't know, do you want to go through those? Let's see.
Yes.
I can read them out to you here.
Yeah, if you can, because I can't see the chat.
Okay.
Right now.
So for events, could we purchase tablecloths and canopies with our program name and logo on them to set up booths?
Purchasing things like, what was the item? Because
Yeah, so tablecloths and canopies with the program name and logo. So just something to, set up at a health fair or a booth.
Mhm. Yeah, I don't see an issue with that. I think we have some limitations with items, like many programs were printing logos on mugs and giving mugs out, or T-shirts, and so SAMHSA has some limitations about things like that. But you're able to print, I think, tablecloths with and a canopy with your logo. I don't see an issue with that because that will be used, multiple events. So that's allowable. I think that's fine.
Okay, and then Heather Summers mentioned that PACS, good behavior game training for teachers and schools, has proven improved outcomes for OUD, and PACS tool community-based prevention trainings for community members. So that's, sounds like it's been an effective prevention tool curriculum. Yes. And then Shara Lene said that they are providing individual and virtual Narcan trainings, and they actually provide Narcan to trainees. I know we're going to cover that. So yeah, that's a big prevention and intervention as well, Narcan. Erica Persley says, I'm implementing more assessments, testing, and surveys to provide tribe-specific data in relation to substance misuse and to be used moving forward in more clearly defined harm reduction and prevention measures. So yeah, so that's great. And that's also, overlaps with data collection, which, we're going to cover, Amy's going to cover in a couple of slides too. Let's see, does anyone have, Lindsay Hurst asks, does anyone have a recommendation for an agency that provides OUD training for communities? We would like to host a training. So I guess, I would want to know more specifically what type of training around OUD, and that's definitely something, you can ask your GPO, or, and we can also work with the TTC, the folks who are helping us host this event. They have plenty of resources that we can connect you with, and, identify some trainings. Someone else mentions they have a needle exchange. So yeah, and naloxone training. Harm reduction can include naloxone prevention and relapse prevention. So that's great. Darian says, we have scheduled a training with National Criminal Justice Institute to provide community OUD trainings for free to tribes. So that's great. So you're connecting with criminal justice. Heather says, we also have a weekly Wellbriety meeting. And I know we are going to talk about Wellbriety. Sandra asks, what about help with utilities to help clients? So we're going to cover that in a couple slides. Thank you for all the responses. Let's see, they keep coming in. So Erica says we have weekly virtual peer support via Zoom and individual peer sessions. So that's great. And Amy, I know, is going to talk more about peer support and recovery activities. And then, okay, Adrian said, can you go into more depth on cups, mugs, and T-shirts? What are the limitations with the funding?
Mm-hmm.
So I think Amy
I
mentioned
think
that.
it's on appendix. It's on the funding opportunity announcement. I believe it's in appendix K.
Yes, the standard funding restrictions are all in I think appendix H, as in Harry.
Oh, appendix H.
Yeah. So, and let's see who would ask that. Adrian, I would say just talk to your GPO about that. We can have a more in-depth conversation about what is and isn't allowed. And, we try to be flexible. There's just some rules we have to follow, but, I think we can work with you to, help you kind of reach your goals. Douglas says we provide Narcan to clients along with training. We have provided Narcan training to all of our staff, both behavioral health and primary care. That's great. And then Abby asks, if we are in a no-cost extension, could we pursue the fentanyl test strips? Would that fall under program supplies? So I think we're going to talk a little more about no-cost extensions later in the presentation, but I think
you can.
Yeah.
as long as, you know, it's not a larger cost over 25%, but you're able to do that under during the no cost extension.
Yeah, and that's another, you know, type of question just to confirm with your project officer. And then our Stone says that they're doing weekly mat support meetings with recovery coaches. Okay, wonderful. Thank you for all the responses.
Thank you. Thank you, Will. Okay, we'll continue with treatment. So in regards to treatment, you can cover the full spectrum of treatment and recovery support services with TOR funds. You can purchase MAT medications, you can pay for the clinicians, all of the services related to medication-assisted treatment are covered. You can also pay for residential services, intensive outpatient, brief intervention, expert strategies. You can do individual group counseling, case management. You can provide referral to services. So you can have a staff that could be just in charge of referring your clients to any services that are needed, as well as family services, so services for the whole family, children's services, the connection with child welfare, as well as drug screenings. You can do those as well, and telehealth services. You can pay for the development of a telehealth platform or for the staff that will be providing the telehealth services. You can have your staff purchase a couple of iPads so your client can connect with their clinicians. We cannot have iPads and phones for clients, but you can have those at your program for clients to use. So they have to be part of your equipment and they have to belong to the staff, not to the clients. You can provide detox services. So detox is covered only as part of an MAT program. So you're able to cover the cost for detox if that client is entering a medication-assisted treatment program. Otherwise, it's not covered with TOR and it has to be covered by private insurance. Okay, so in regards to recovery, many of you said you're working with peer support specialists. So you're able to do that. You're able to hire peer support specialists and cover for their salaries. Also, we discussed, covering for their training so they can become certified. You can also fund recovery housing. And SAMHSA recommends that recovery housing is certified recovery housing. And we know that in many tribal communities, there are no, that is not an option. You don't have certified recovery housing. So you're able to cover for the costs of transitional housing, sober living, or any other facility that, as long as that client is receiving treatment services and has contact with a case manager or a peer mentor, you're able to cover for housing costs for a period of time. It can be really long-term, but we do want to ensure that the client is able to participate in treatment, and they are not able to participate in treatment if they have no housing. So we do understand that. So depending on the housing options that you have, please contact your GPO and we could work with you, because I have many grantees in Alaska in very small villages where housing is just very, very limited. So we have been able to make some exceptions for those TOR grantees. You can also implement Wellbriety groups, as some of you have said that you're doing. Wellbriety groups are very, very successful, as well as any type of 12-step support groups, relapse prevention or aftercare groups. Alumni groups is something that many of you are starting to implement. You could also plan activities that are alcohol and drug free, like many of you do movie nights. I heard a lot about movie nights where you invite a lot of the families to come and watch a movie in an alcohol and drug free environment that is safe for the families. You can also cover the costs of other things that can support the recovery of your client, like nutrition, acupuncture, wellness programs. Some of you are doing yoga, any alternative treatments to pain management as well.
And we got 2 questions in the chat. So
Sure. We could actually
just-
pause here to take some questions again regarding treatment and recovery.
okay, so just on the issue of mobile devices, Holly asks, are staff phones covered as a wraparound service?
Staff funds are covered, yes. So you're able to use TOR funds to cover for funds for the staff that have to use their funds when, to respond to clients. So yes.
Okay, and then Dorothy Crust asks, how long can you fund certified recovery housing? So I know you said, it can't be very long, but does SAMHSA have any hard limits on how long you can pay for recovery housing?
We don't have any limits. I don't think we have a specific limits. I mean, I personally recommend 4 to 5 months and ensuring that the client stays in treatment. And I think our goal is to ensure that the client is able to have employment and be able to find their own housing. This is supposed to be just transitional while the client is attending treatment sessions and needs that support. So we really allow you and your clinical team to make that decision. And also that also depends on how the client is progressing. Is the client doing really well? Is the client moving towards, all the phases of your program? Have they been, very responsive to treatment? And depending on all of that, I think you could make an assumption and say, yeah, we could probably, if this client really is looking for a job and can't find a job, and we know he is looking for a job, then we could, maybe help him for 2 additional months. But that's really up to your individual program and to your team. It's something that you could discuss during your staffing meetings and make those decisions. We don't have any specific guidelines about that.
Okay. Erica says, I am currently a state and nationally certified peer support specialist. So when I graduate from college, can my TOR grant cover the expense of licensure as a substance abuse counselor?
Yes, it is an allowable cost. I mean, you may have to discuss that with the project director and ensure that everyone is on board with covering for that cost. But it also has to be part of your initial objectives of the program. The program has to have peer recovery support as one of their objectives. And if not, we may need to discuss that with the project director and see if that is now a new objective that they would like to add. But as long as that is part of the program's objectives, we can, it is an allowable cost, but it is the project director's final decision to decide to cover for that.
And can funding be available to start a peer support program?
Yes. And actually many peer support programs have been started with TOR. We do have many TOR programs that are funding their entire peer support program with their grant.
Okay, and then Darian asks, could we purchase fitness material such as bands and foam rollers for clients to use for physical therapy at home? I think
so. I don't see an issue with that.
Just maybe, I know, we definitely, Amy covered this before, just, as we want to be able to support wellness programs and, things like fitness, part of holistic recovery. I think in general, you're able to purchase things for the program, that clients can sort of like rent out and borrow. So as long as, you're not purchasing all this equipment for each client, to keep, I think that might not be allowable. So, but I understand, due to COVID right now, people can't really gather in groups. So, it might be possible to do something where you purchase exercise items for clients to use at home. I would say, yeah, talk that over with your GPO. And yeah, I think you're hearing us say that a lot, but in general, anytime you want to make changes to your budget that's on file, it's a good idea to talk it over with your project officer. And then can funding be made available for the cost of a dietitian and exercise specialist as part of a wellness program?
Yes. Yeah. So you could definitely cover the cost of a dietitian and someone that could help your clients with nutrition lessons, healthy, eating, healthy cooking, things like that. Definitely that is part of a wellness program, but it has to be tied with the client's recovery. So one of the things that I do recommend is that you develop a recovery package that includes, some of the wellness programs, as well as, maybe sobriety groups and relapse prevention groups and other type of sessions that could also help your client stay on track with their sobriety.
Okay, and then Jody asks, how about bicycles to have transportation to sessions and to the hospital? So can they buy bicycles?
I think we did receive that request, and unfortunately, I think grants management said that that was not an allowable expense, because we'll talk a little bit about transportation and the options that we have. I think purchasing bicycles for clients was not approved by grants. Able to actually get approval, and this is something that has to be approved by grants management. Get 2 bicycles and have clients, maybe let them borrow the bicycles for a period of time, but you cannot purchase bicycles for 5 or 6 of your clients. I don't think that will be allowable.
Yeah, and grants management, that's our finance office, and so many of these things are really decided by them ultimately. So as much as we want to be flexible, we kind of have to follow, their rules. So the next question is mortgage payment considered recovery funding? So yeah, I think we're going to cover this topic a little later on, but if you mean, helping a client pay their mortgage, I think we might not be able to cover something like that. We want to definitely, we want you to be able to make some funds available to clients to help them meet, their basic necessities if that's going to prevent them from accessing treatment. But I think there might be some restrictions on paying for their mortgage payments. So when we have a salary covered, such as a SUD counselor, we can still bill for a patient visit if they have Medicaid or other insurance reimbursement. So can they still bill Medicaid or other insurance if the TOR grant is paying their counselor's salary?
So you should bill the third party or insurance first, and for any costs that are not covered, then you can use the TOR grant to cover for those costs.
And yeah, I think if you are billing, and getting reimbursed, that is technically considered program income that, you need to track, and that income is supposed to be kind of put back into your grant program, into those goals and objectives. So I know that's something our finance department asks programs to keep track of, any program income. So Bo asks, can we purchase beads, sinew, leather, and other Native American themed regalia and items and pay for contracting experts in these types of activities?
Yes, that is allowable. That is allowable for TOR. Yeah, for many of you that have other SAMHSA grants, please keep in mind that a lot of the things that we're covering today may not be allowable for those other grants. And this is one example where we're able to cover for things that that you're able to utilize during cultural sessions and have someone come and teach your clients how to do beading or some of the basket weaving, any other activities like that. But that is very specific to TOR.
Okay, and then so someone, I guess, in reference to the bike, so it would be like a bike library. So I guess you could say you could have a program set up where you're loaning bikes out to clients.
Yeah, but again, that has to be approved before you purchase the bikes. Please send us an email for approval. That is something that has to be approved by grants management.
And then if Erica is saying, if you don't have peer support in place and would like to work towards that, I'm glad to discuss that with anyone. The grant covers well-variety training and workbook and materials for your clients. And I can also share about RAP, MI, and CBT training information. So definitely reach out to Erica. She has her, you can message her through the chat, Erica, if you want to share your email, and people will know how to contact you. So thank you for that, Erica. And then Shirley asks, can we get the written material that cites what the parameters are about program income? And yes, we can definitely share that. It should be part of the your notice of award. Everyone should have gotten a notice of award from SAMHSA when they first started getting funding for TOR. And that is where you'll see the language about program income and how to handle that program income.
Yeah, there is a part on the federal financial report, the FFR, where you have to report that.
Yeah, so that's all the questions for now.
Okay, great. Well, thank you so much for participating. Let's see, we will continue. Okay, with additional assistance. So in addition to just, we just covered some of these, but you can pay for anything that is not covered by insurance or other third billing parties. So you could cover for copays, or if your client has to pay some treatment services out of pocket. So they're going to intensive or outpatient treatment, and there are some costs that are not covered, you can use the TOR grant to pay for those costs. You can cover it for transportation, and we did discuss about the bikes, but you could also do, other programs are paying for Uber, Lyft. They are paying for, they're providing bus passes, or they're leasing a vehicle. And that is something that if you're in year 1 or year 2, you may be able to adjust your budget for a vehicle, if you could lease a vehicle to take your clients to treatment and from treatment. So those are some things regarding transportation that the clients are doing. You could also provide assistance for clients that are transitioning from jail or prison into the community. So I heard from a program that is actually hiring a case manager that will be working with that client pre-release to just see what needs that client has, and we'll actually keep working with that client post-release on linking the client to services like assistance for housing, employment, anything that the client needs. And this could be simple things like just providing the client with hygiene kits or some clothes, or just a basic, bus pass card so they could start taking the bus to go to places and interviews and things like that. So you could pay for a case manager to do that kind of work and ensure that the client goes to treatment and starts treatment as part of their recovery. Okay. You could also use TOR funds to assess the impact of your grant. You could work with an independent external evaluator. You can hire someone to help you with GPRA data collection, GPRA data entry. We know that it's a lot of work, but we do have a lot of programs that are hiring staff to do that. And as we discussed earlier, you can have contracts. So if you're not able to provide some of these services internally, you can have contracts. We have seen programs that have contracts with traditional healers. Many programs are doing contracts for psychiatric services, cultural interventions, equine therapy seems to be very common in some areas. Any type of clinical services. A lot of our TOR programs don't have sometimes the capacity to have a MAT program internally, but they do contract with a treatment provider that they are providing the MAT services. And the grantee, the TOR grantee, refers clients to services, but they don't necessarily provide the MAT treatment, as well as any type of prevention and multimedia campaigns. So I think TOR is very flexible and allows you to really cover for the entire continuum of care. And you really could use these funds for almost anything, as long, again, just remember the cost must be allowable, allocable, and reasonable. And that is our only requirement. Okay, I will turn it over to Will now, and he will cover some additional allowable activities.
Okay, so let's see, I'm going to try and share my screen, see if we can.
Okay, let me know if I could stop sharing my screen.
Okay. Can you see the presentation there?
Yes.
All right. And so, yeah, Amy has talked about required activities under TOR, and now I'll be talking about some activities that aren't necessarily required, but that are allowable for you to do. And I think we covered quite a few of these already, but we can definitely go through them in a little more detail here. So one thing, that you're able to do with TOR is to incorporate culturally appropriate and traditional practices into your program design and implementation. So, we kind of just use these terms, culturally appropriate, traditional practice, to cover, a huge range of activities, including these examples here, like sweat lodges, talking circles, traditional healers, purchasing supplies for any of these things. I think Bo had asked about that, supplies for traditional crafts, pottery, basket weaving, beading, supplies for fishing, expeditions, retreats, equine therapy. I think, when we've talked about equine therapy before, we found it was maybe a more cost-effective use of grant funds to contract with someone who can, bring those services in. So definitely, and this is not a complete list. So please reach out to your GPO if you have other ideas, for some things you want to incorporate into your TOR grant. And then the second activity here is to support telehealth strategies to increase your capacity to serve, your community and provide prevention, treatment, and recovery services. So again, that could include purchasing phones or tablets for your staff. But, unfortunately, we're not really allowed to purchase phones or tablets for clients or to cover the costs of their phone or internet plans. At this time, we can't fund that, but, you are able to purchase phones and tablets for your staff. And then, you're also allowed to use TOR funds to address any barriers there might be, to receiving MAT by reducing the cost of treatment, developing innovative systems of care to expand access to treatment, and to engage and retain patients in treatment. So some examples of that might be purchasing MAT medications or helping, defray some of the costs of medications, providing transportation assistance with gas cards, bus passes, rideshare rides, which I think, Amy talked about, leasing or purchasing vehicles. We have plenty of programs using TOR money to lease or purchase a van to help with transportation. If that's something you're interested in, there's some special documentation we ask you to complete. So please contact your GPO if you're interested in using TOR funds to lease or purchase a vehicle. And you can also implement contingency management, and you can provide light snacks, not exceeding $3 per person per event. So, you are able to provide some amount of, put some amount of money towards food and I think we call it light refreshments or light snacks. So those are some allowable activities. And other forms of assistance that you can provide to clients includes skill building classes. You can, pay for financial literacy, job readiness, parenting, nutrition classes, or, other, skill building classes or groups you might have in mind. Treatment incentives, such as hygiene products, gift cards, phone cards. So you can, buy phone cards, with minutes for clients. So there's, a little bit of flexibility there with the phone issue. And, this overlaps with contingency management, providing these treatment incentives. And you might have other ideas for incentives you want to provide. And you can also help, clients with covering the costs of some necessities that, what might otherwise keep them from accessing treatment. So, you know, if they need childcare, if they need transportation, or, you know, some other type of assistance, you can use TOR funds to cover those costs on a sort of case-by-case basis. So I think we ask that you know, talk to us about that if you have questions. Again, we want to try and be as flexible as possible.
Yeah, could we pause for a moment, Will, to take
Sure.
comments? A lot of comments and questions are coming through the chat.
Okay.
So Charlene is asking, which area of the grant is the hygiene and clothing covered under? Does it need to be already written into the no cost extension? So I can respond to that. So if
Okay.
you are providing hygiene kits and clothing for clients that may need, you know, basic items, you can do that under other. You could do, and it doesn't have to be written into the no cost extension. I think that is something that you can add as long as the cost is not very large. Just again, let your GPO know, but it could be covered under the other category in your budget. And let's see. And then we have another question from Tosa Tuhard. What about gardening or community gardens?
Oh yeah, that's definitely something, you know, that's allowable. I think you could, you know, have that type of activity either as a prevention activity or recovery activity. And I know we do have a couple programs doing that. They've, you know, really had a lot of success with that. So definitely gardening, community gardens are an allowable activity.
Okay, and then we have a question from Sarah. Is there a cap on the amount of assistance per client? Is contingency support capped at $100 per client per year and $15 per encounter?
Yes, that's correct. So you are able to, you know, provide contingency management support, but there is a restriction, a limit on that. So each contingency, you know, is limited to $15, you know, per contingency, and then you can't provide more than $100 to each client in a given year. And we're going to have, I think there's a slide on that coming up too. So
yeah, but that is specific for contingency management, but for other assistance that you provide to your clients, for example, assistance with transportation, assistance with co-pays, if you're helping that client maybe with nutrition classes, those things don't really have a cap. I would put those up, you know, that type of assistance, even under recovery support services. So we don't really have any specific cap for those type of items. But for the contingency management incentive, that has to be $100 maximum per year. I just wanted to clarify that. Yeah, and then there's another question from Sandra. Can we purchase phone cards?
Yes, yeah. So I think we mentioned that on the slide here. You know, those could be purchased as a type of incentive, or, you know, if it's something that a client needs in order to access treatment. You know, I know a lot of clients might be getting counseling over the phone right now. So, you know, if they can't, you know, access treatment otherwise, then that's certainly something you can help them with.
And let's see. I think Dorothy asks if we will be providing this a copy of the PowerPoint presentation. I think Kate, did you send the presentation? It was already sent, but we will let's resend it after just to make sure that all the participants receive it.
And all these, we'll do that. All of these presentations are posted on the recordings, and the slides are posted on the TTC website. So, you know, we can share a link to that. So you'll be able to refer to them, you know, anytime in the future.
Okay, and there's another question from Sarah. Is contingency management different than providing assistance for transportation and housing? Yes, so it is. It could be different. So as part of your recovery program, you can provide assistance for transportation and housing. And that is not necessarily, it doesn't have to be part of your contingency management program. For example, for your contingency management program, you can provide a $15 gift card to a grocery store or to Walmart or to any place you would like. And that, and every time the client is doing something that will, that is part of your programming, that they will receive an incentive, you could give them a gift card. And that is something separate from the housing and transportation that you're able to pay with your recovery, with the recovery aspect of the grant.
Yeah, and just to follow up on that, if you're doing contingency management, ideally you would have it kind of structured beforehand where okay, when a client meets these discrete treatment goals, like, they've come to 8 out of the first 10 counseling sessions, we'll give them this contingency, this incentive, and you have it, kind of a, laid out that way to kind of, incentivize client meeting certain treatment goals. So that's separate from, providing like emergency assistance to clients for transportation, housing, childcare. That's just something you can do anyway, apart from a contingency management program.
Okay, our next question is from Gary. Is there a cap for childcare?
Yeah, so there's no, hard caps on the assistance you can provide. There is a cap on, the contingency management. There's a cap on GPRA incentives, which I don't think we've mentioned yet. But that being said, we don't necessarily want you using all of your grant funds to pay for some of these necessities costs. Really, we're just offering this flexibility kind of on a case-by-case basis, where a client won't be able to access treatment, for want of childcare or, transportation assistance or some other necessity. So, there's no cap in writing anywhere, but I think, we definitely want to kind of evaluate these on a case-by-case basis.
Okay, and then we have, I think, a comment from Erica. Other great incentives for peer support participants are smudge kits, seeds, drum, craft supplies, fried bread mix, wild rice, etc. So yeah, those are really, really good examples. Thank you, Erica.
Yeah, those are great. And I think we have a link to a resource for contingency management ideas that mention some of those types of incentives as well. So, all right, let's see, I'm going to head to the next slide here. And Amy, I think you covered recovery housing. So recovery housing is an allowable activity. And as long as, it's being provided in an appropriate and legitimate facility. And, SAMHSA defines recovery housing as a safe, healthy, family-like, substance-free living environment that supports individuals in recovery from addiction. But, when we say substance-free, that doesn't prohibit prescribed medications such as, buprenorphine or other prescribed medications. And then we offer a link to some resources, on best practices and guidelines for recovery housing. And then SAMHSA published some FAQs around this time last year related to COVID-19, just because it, has disrupted everyone's grant in some way. And we want to, try and be even more flexible to help you sort of adapt your program to the changing conditions. So, so TOR funds can now be used to implement telemedicine, telehealth services. If you weren't already doing that, you can hold virtual meetings and trainings. You can purchase personal protective equipment for grant personnel working on the grant. You can purchase laptop software and other items to deliver training and services specified under the grant. And that sentence in parentheses is just, you can't purchase laptops, other devices for clients, or internet services for clients. And here's a link to the complete list of FAQs related to COVID. In general, if there's a way that you want to adapt your program to, a virtual setting or a socially distanced kind of setting, you can use grant funds to cover the costs of, adapting your program, whatever that might be. And then, yeah, here we talk about contingency management. So, you know, TOR funding allows you to use contingency management. I know there's good evidence on using that to address stimulant misuse and stimulant use disorders. And as someone mentioned, there's a cap on the amount that you can give per year to each client, and that's $100. And here we link to this tool that the TTC had developed, and I think Kate links to it in the chat as well. It gives some great ideas on incentives. Another type of incentive you can provide is incentives for completing the follow-up GPRA. So you can provide up to a $30 non-cash incentive to individuals to participate in required GPRA data collection follow-up and the discharge. So you can give a $30 gift card for the follow-up interview and a $30 gift card for the discharge, the discharge interview. You can't give a $30 gift card for the intake interview, but yeah, those you can, you know, for those two follow-up interviews. And, you know, we find that this is just a great way to improve your, you know, follow-up rates and improve the chances that you'll be able to connect with the client to get some of that follow-up information. Fentanyl test strips. So, okay, yeah, let's see. I have the chat here. I'm seeing some questions. So Farah says, it was previously mentioned about conference light sacks at $3 per person. I just want more clarification. Do we base this on estimated number of attendees or actual attendees? So you can base it on, you know, the estimated number of attendees when you draw up your budget. And that's, yeah, $3 per person per event. That's kind of the limit we're held to right now. So, you know, if you want to buy light refreshments, snacks, drinks for, you know, a meeting, a gathering, you're able to spend $3 per person who you expect to attend for, you know, to cover those costs. And then Ann-Helene, hello Ann-Helene. She says, we will provide training on how to implement contingency management as part of the treatment plan. So that's good to know. The TTC will be providing some contingency management training, so stay tuned for that.
And I can add something to that because, as you both have said, contingency management is a very, very strong addition to any kind of treatment that we provide. But it's only effective when we have it as part of the treatment plan. So there is a reason why, if you are able to say you use UAs as a way of evaluating how the client is doing, and you can include then a goal of, okay, if you have had X number of UAs that have no trace of anything else but the MAT, then you will get such and such incentive afterwards. It all depends on what you and your client agree on as a good behavior to promote.
Yeah, thank you for that. That's a great point. And
yeah, our next question is from Heather. How is non-cash defined? So I think SAMHSA just has a restriction on giving clients $30 in cash, or you're able to do gift cards. You're able to provide practically any gift card to any place that you find helpful, you know, for your clients. But you cannot provide actual cash. And I think that is the only restriction.
okay. And just to jump down, someone, Andrea asked who was talking just now, and that was Ann-Helene Skinstad, and she is the director of the American Indian Alaska Native Technology Transfer Center. So she oversees the wonderful team that helps us put on these events, and you know, they provide a lot of training and technical assistance to TOR grantees. And so let's see, Adrian asks, what about the purchase of food for cultural activities? For a majority of my tribe's cultural events, food is a big component of the cultural activity. For example, food to eat after having a sweat, such as soup and crackers. So yes, apart from that $3 per person, light snack kind of restriction, if we're talking about, food that's specifically tied to a cultural activity that, is worked into your treatment or recovery or prevention program, you wouldn't necessarily be held to that $3 per person limit. I think we would just want to hear more details from you, about the expenses we're talking about. I know there's, a lot of traditional practices around food, the preparation of food. And so, we want to be able to support that as well. And Cheryl asks, is contingency management covered under treatment costs? So I guess strictly speaking, under your budget, the contingencies might be under supplies or other, the way the budget breaks down.
But I think it would make sense to put it on treatment. It is an evidence-based practice under treatment, so you can have the contingency management under treatment with
Right.
with the incentives as part of treatment.
Okay, and then Beth asks another clarification. Prevention funds can be used for billboard advertising. So yes, you can use your TOR funds for billboard advertising, as long as you're, we're talking about either advertising your TOR program or some, prevention messaging. The message that you're displaying should be related to your grant.
Okay. I think those are all the questions we have, Will.
Okay. Yeah, so I think I brought this slide up. So, this is a new development for SAMHSA that grantees can now use funds to purchase fentanyl test strips. And we link to the official SAMHSA announcement here. So once you have the slides, you'll be able to see that. And I know we've gotten a couple questions from projects, asking us where to purchase fentanyl test strips. And I think the best resource right now would be someone, at state behavioral health agencies, because they are likely already purchasing fentanyl test strips and they might know, about a reliable provider. We can't really connect you with, a seller of the fentanyl test strips. So I would recommend reaching out to maybe someone at the state. Oops, let's see, what did I do? And we don't really, this is a relatively new kind of practice. And so we don't really have, detailed federal guidelines to provide on this just yet. I know I had gotten a question, is there more instruction? But I think, if you have questions about how to implement a fentanyl test strip protocol, definitely talk to your project officer and we can, work with you on that. And then just to get into the spending restrictions. So we've talked a lot about, things that you can do, but there's just a couple of things that you're not really able to do with TOR funds, or some limits on what you can do. So you can use up to 25% of your grant funding for data collection costs and performance assessment costs and infrastructure development. So Amy had mentioned some examples already, working with tribal epidemiology centers. They're, a great resource for doing some of that evaluation work. You can use funding to hire data entry staff to help you with, GPRA data collection, GPRA data entry, because that can be, pretty labor intensive. And only FDA approved products can be purchased with TOR funds when we're talking about, purchasing medications, covering the cost of medications. So for, the treatment of opioid use disorder, you're limited to, buprenorphine, methadone, and naltrexone, as those are the only 3 FDA approved products at this time for that purpose. Did I jump too far? Okay. And just a couple other standard funding restrictions. And you can always look in your FOA, the funding opportunity announcement, Appendix H, as in Harry. There's a standard list of things that you can't do. So there is a salary limitation on the amount that you can pay staff working on the grant, and that changes every year. So I would recommend, if you think you have a staff member who might be close to that, to check out that list. I think it's around $200,000 a year. So, if you have doctors, medical staff who might be near that, you definitely want to check that they're not being paid in excess of the salary limitation. You can't pay for any lease beyond the grant period. You can't pay for construction of any building. So you can renovate buildings, make alterations to existing facilities with TOR, but you can't construct buildings with TOR money. You can't provide residential or outpatient treatment services when a facility has not yet been acquired, cited, approved, and met requirements for human habitation and services provision. So, you have to have a facility in place, ready to go if you're going to be providing treatment there through the grant. And Amy mentioned this already. You can't provide detox services unless, you're transitioning clients to MAT from being detoxed. You can't pay individuals to enter treatment or to participate in your grant. You can do these incentives when clients reach treatment goals, but you can't pay them to participate in treatment. And then here's just the wording for that $3 per person meal requirement, which we've talked about. And, we want in general to support evidence-based treatment approaches, where those, where there are evidence-based treatment approaches. So we don't really want to be funding non-evidence-based treatment approaches. And then again, see Appendix H of your FOA for a complete list. And so, we've been talking about things you can spend money on, changing your budget. So, lastly, we're just going to cover how that works briefly. So you can make revisions to your TOR budget with SAMHSA approval. You're not necessarily locked in with your budget, but Amy mentioned at the beginning that if you're in a no-cost extension, you're in your final year, the rules are a little bit different, and I'm going to cover that on the next slide. But in general, if you're in your first year or in your second year, you can make some changes to your budget. And depending on, how big the change is, you might have to submit a package of documents into ERA to make the change. So we ask you to submit a post-award amendment budget revision. So that means a revision into ERA. We ask you to submit that if you're going to be reallocating funds that exceed 25% of your approved total budget. So we always talk about this 25% threshold, or $250,000, whichever is the lesser amount. You would also need to submit a formal budget revision if you're purchasing equipment over $25,000, such as a van that wasn't already approved in the application. And then if you're going to be rebudgeting funds, which means you're moving money to a category that didn't previously have any money in it. So for example, if no equipment was originally in your budget, but now you want to fund some equipment, then we need you to submit a new budget to us into ERA. And we have to approve that before you can make those changes. So if none of these conditions apply, you can make these budget changes just by sending an email and getting approval, from your GPO through email. And, as a reminder, just always notify your GPO if you want to make changes to your budget. And then for grantees who are in a no-cost extension, you have limited flexibility just because, a no-cost extension is really supposed to give you some time to, complete activities and spend down money that was already, activities that were already approved. So unfortunately, you can't submit any formal budget revisions during a no-cost extension. So you're kind of limited to that 25% threshold. So you can make some budget revisions under that 25% threshold, as long as we're talking about, previously approved line items or, line items that are consistent with, your approved grant and line items. You can't make any changes to the contracts category in the no cost extension, and you can't make any equipment purchases over $25,000. And just again, notify your GPO of any changes you plan to make, whether they are over the 25% threshold or under. So I know that's a lot of information, but you'll have these slides to look over after we're done here. And so, at this point, we can look at the questions. So that's the end of our presentation.
Yeah, we have some
So-
comments and questions on the chat.
Okay.
Yeah, Pam says the DEA just came out with a stat that 1 in 4 illicit pills found through arrest tested positive for lethal amounts of fentanyl. So the testing strips are real lifesavers. Thanks for supporting this. Thank you. Yeah, well, that's good information to know, Pam. Yeah, unfortunately, yeah, that's really high. And Sarah asks, we would be interested in learning about the approach or scripts for providing or issuing the fentanyl strips to clients. What would a typical conversation look like? So far, we know that programs that have been distributing the fentanyl strips are doing it in the same way as naloxone, like how they distribute Narcan. They may be including some strips with the Narcan kits that they distribute with some information about, what they are, how to use them. But that's how I heard the programs are distributing the fentanyl test strips. I could ask others to chime in and see, how they're having conversations about fentanyl test strips with clients and how they're distributing those. Or if the ATTC has any ideas about that as well.
Yeah, I think, at this stage, the evidence base is still kind of evolving for the use of fentanyl test strips, but what we've seen so far is that it can be a pretty effective harm reduction intervention. So, all we might really have to share at this point are just some of the research studies and resources from some of the harm reduction, advocacy groups. There's not really much, federal guidelines that, that are available just yet, but we can definitely connect you with something. Let's see, I got lost with the questions here.
Yeah, we have a question from Douglas. We have a contract with our IHS funded hospital pharmacy that says we can only buy pharmaceuticals from them. Will using the TOR money to purchase treatment medications be in violation of this contract?
Yeah, I would take that up with them, just to see whether, that would be allowable or not.
Yeah. Yeah, I would recommend that you let them know that you have TOR funding available to cover for these costs. I would assume that they would want to use other funding if that is available, versus the IHS funding that may have more restrictions. But yeah, you may have to have the discussion with them and let them know that, TOR, the treatment medications are allowable with TOR and you have that resource.
And I know, in general, SAMHSA, we want to try and be the funder of last resort. So if you have other resources, if medications are already available through the IHS pharmacy, I think we would ask you to tap into those funds first before covering them with TOR.
Mm-hmm. Yeah, but if those are limited, for example, if you would like and you feel that there is a need for buprenorphine, and for example, if that is not covered or not provided by the pharmacy, I think you're able to expand on what the IHS funded hospital pharmacy is able to provide.
And then, yeah, I see Jody asks, where can you find the Appendix H with this funding restrictions? So yes, it's in your funding opportunity announcement, and Heather had linked to that. You just have to make sure that you're looking at the correct year. So, some of you might be in year 1, some might be in year 2. So make sure you're looking, the funding announcements differ kind of somewhat from year to year. So make sure you're looking at the one that applies to your grant year. And let's see. Donna had asked to list the medications that can be purchased with TOR. Yeah, I think, TOR is focused on expanding access to medication-assisted treatment for opioid use. And so, the medications we really, want to support are buprenorphine, naltrexone, and methadone. So thank you, Heather, for that answer. And Douglas says, Their CPR training includes Narcan use now, and state program includes fentanyl test strips in their Narcan kits. So that's great.
Great, yeah.
All right, here, I'm going to stop sharing here. So were there any other questions about any of the topics we covered today? Well, as we've said, repeatedly, just if you do have questions about whether a particular activity is allowable through the grant or not, please, don't hesitate to contact one of us. I had our names up there on the screen. If you're not sure who your GPO is, just, you can always reach out to any one of us and we'll, get you connected with your project officer. And Shirley, thank you, Shirley. Shirley provides a link to the definition of program income for the grants. Okay, and Douglas asks, does this include all forms of buprenorphine, oral and injectable? Yes.
Mm-hmm, yes.
Yeah, so, and oral and injectable naltrexone. So yeah, any formulation of the 3 medications.
Okay, so that concludes our presentation. Thank you. I will turn it over to Kate.
Thank you both so much. It was really, really wonderful, very helpful information. And I wanted to point out that a few people were talking earlier in the session. People had questions about funding for training in different areas, peer support, OUD training. People were mentioning motivational interviewing, and those are actually, like, all of those that I think were mentioned are trainings that our center is equipped to offer. And so if you are looking for someone to train your group, please reach out to us and we would love to set something up, virtual, or we're getting closer to being able to plan to do some of these things in person. So that might be a possibility soon. So yeah, it's very exciting. I'll put a link to our ATTC page, which lists a bunch of the trainings that we offer through the ATTC. And also my colleague Kathy Comlin mentioned too that we also do intensive learning collaboratives and things. So I can't remember, Kathy, if you remind me exactly what they're called, but groups who want to practice your skills in SBIRT and MI, we offer groups like that as well. So Kathy, did you want to more?
Yeah, there are booster sessions that are designed to offer a skill, more focus on skill development for the people who are interested in doing more consultation and supervision around their practice, which would include bringing any of your tough cases, having discussions about it in a small group format. And we're offering that as a part of all the SBIRT trainings I'm doing, and we're offering them as a part of any of the motivational interviewing trainings that I'm doing, which is really what the research says, is going to a training doesn't transfer to skill. Doing the booster sessions and getting support and getting your specific questions answered is really what helps with implementation. So we're offering that as part of those trainings. I call them booster sessions.
Yeah, thank you. Thank you for clarifying. I couldn't remember the terminology.
Yeah.
So please feel free to get in touch I put my email in the chat, and I will be sending out an email to everybody probably by the end of the day today with, it'll include the slides, the recording of today's session, as well as some of the links to the resources that have been shared. So you'll get that email from me, and you'll feel free to reply, give us any other feedback that you have, but we'd also love for you to fill out our GPRA survey, just letting us know what you thought of the session today. Yeah, and I think that does it for us today. So yeah, we Really appreciate your questions. It was really wonderful discussion. It's so great to hear all of the ideas and the programs that you're offering and the passion that you all have for your work. So thank you so much for letting us be a part of it. Shirley, it looks like you were going to say.
Can you hear me?
Yeah.
Can you hear
Yep.
me? Okay, great.
Yeah.
I sent you a quick start guide for OUD. So, and it's very informative. And so I don't know, will you be posting that on the website or sending that out?
Yes, I'll do that. And I'll include that in the email that goes out too. So thank you.
Right. Thanks.
Wonderful. Okay, well, I think that'll finish us up for today. And again, just want to thank you all for joining us. It's so great to see you, and hope you all have a wonderful day.
Thank you.
Bye, everyone.
Bye-bye.
Thank you all.
Thank you.
Bye.